Hello, my name is Sophia and I teach at Kinesis Pilates. Today we're going to talk about core stabilization and what I like to call the box of your core. So we are going to identify some bony landmarks to help us stabilize this area of the body. The two first ones I want you to find are the front of your pelvis. It's called the anterior superior iliac spine, or the ASIS, and it's at the very front of the ilium. If you put your hands on that, it's usually what we refer to as like putting your hands on your hips, which is actually not the hips, but rather the iliac crest of the pelvis. The hip is considerably lower. So if you find that ASIS and put your third finger on it, then you can find your ribs, the base of your ribs, with your thumb, and you're just creating this little box or square of your core. And as much as possible, we want to keep this box level and parallel and square and all the lines parallel to each other when we're moving in Pilates and when we're moving in everyday life. The muscles that support that core and stabilize that square are the transverse abdominis, these horizontal fibers that run around your belly and help pull your belly button in towards your spine. We also have the obliques on the side, the rectus abdominis in the front, which comes down and attaches all the way to the pubic bone, and then all the muscles on the back, including the paraspinals and the QL. Once you've stabilized this core of the pelvis, we're going to start to move the leg in the hip socket. And we want to make sure that movements of the leg do not take the pelvis with them. So the hip socket is the second most mobile joint in the body after the shoulder, and we should be able to flex at the hip, extend at the hip, internally rotate, externally rotate, adduct, and abduct without taking this whole pelvic structure with it. So every time we move the leg, we want to feel the core stabilize, and then the leg can actually be moved instead of by the pelvis just kind of falling out to the side, by the muscles of the hip. So the deep six rotators can start doing their job, gluteus medius and minimus can do their job, the hamstrings can do their job. We want all those muscles in the butt to be able to function properly, and they can't unless this core is stabilized. So now that we have a little bit of a foundation, we are going to learn how to actually stabilize that core. I'd like you to lay down on your mat. Your feet are going to be flat on the floor and about a hip distance apart, which is a fist between the knee and a fist between the feet. So you'll get the feet into that position, and then we're going to try to find our bony landmarks. So generally the middle finger I put onto the ASIS of the pelvis, and when you're laying down, it's pretty easy to identify it because it tends to protrude a little. And then you can put the thumbs onto the base of your rib cage. When you're in this position, you want to make sure that you don't have any tilt of the pelvis. So if you do form a triangle with your hands and put your palms onto your ASIS and your fingertips onto your pubic bone, if you feel that your pubic bone is higher than your ASIS is, then you've got what we call a posterior pelvic tilt or a tuck. If you find that actually your palms are higher than your fingertips, then your ASIS is higher than your pubic bone and you've got an anterior tilt, which you see also arches my low back. You want to create a position where your pelvis is level, so the fingertips and the ASIS is under your palms or parallel to the mat. Then you can find the box of your core. I want you to identify two things. One, whether or not you're hiking one of your ASISs up towards your rib, in which case one finger would shorten. You might identify some wrinkles in your shirt if you're wearing a tight shirt, and then you can try the other side as well. Or whether or not one is falling into the mat or kind of spinning back, okay? So we want to find the ASISs in a neutral position in the pelvis with the triangle check. And then when we put our hands into this little square check, we want to make sure that one side is not hiked up, nor is it dropped, okay? And so if one side drops, you'll feel the other side lift up. So you're looking for parallel lines in the square here, as well as the two ASISs being parallel to the mat. Once we've created that nice square, we're going to maintain it by contracting the core musculature. So you're going to feel Your belly button, you can pull it into your spine. Sometimes you can think of knitting the waist together so you feel like you just, these rings around your abdomen narrow. Once you've engaged your transverse abdominis like that to stabilize your core, you're going to lift one leg to a tabletop position, 90 degree at the hip and knee, and then set it back down. And you want to watch for dropping. So you don't want to lift one leg up and find that same pelvis dropping. Then that motion is not just in the hip socket, and it's actually compromised the pelvis and the spine. So we want everything knit together, and then we fold one knee in and set it down, and fold the other knee in and set it down. If you do find your pelvis hiking or dropping, you're going to focus on engaging the transverse abdominis. You're going to focus on lifting the leg with the psoas, and you might feel like you actually need to engage a little bit in the glutes. So in the bottom may need to be a little bit active to help keep this core stable. Generally, you can do as many of these as you feel comfortable with. There's really no limit in this exercise, provided that you can keep your core maintained. I don't ever really want to see protrusion of the belly, arching of the back, and then lifting of the leg. In that case, you have not stabilized your core. After you feel successful with that exercise, you can increase the challenge by folding the knee into 90 degrees and then abducting the leg. So now as the leg pulls away, the tendency will be for one side to drop while the opposite starts to lift as more and more of your weight drifts away from the midline. So this takes considerable effort on the opposite side of the moving leg to stabilize the core and prevent any kind of dropping of the ASIS. We can use breath to facilitate this movement. An exhale helps contract the core. So if you'd like, you can take a breath in and then exhale to lift the leg. Inhale to let the leg go out, and then exhale to return it. So breathing in, exhale, inhale, and exhale. As this leg is drifting away from the midline, you'll find that you can also engage the glute on that leg to help provide stability. So now that my core is engaged and holding my square of my pelvis, when this leg drifts to the side, if I engage those glutes and those abductors to take the leg away, it doesn't pull on my core quite as much as if I just let gravity bring my leg down and let it drop. So engaging your core on your stable side, engaging your glutes on your mobile hip, and you'll find greater success with this exercise. One last thing I'm going to mention is that you may be leaving your foot at the midline and just turning the knee out. I would prefer that you take the whole leg with you, which is a more significant challenge. If you find that you are dropping in the ASIS of the abducting leg, perhaps you can reduce the range of motion. You do not need to make this big. You can just take it out a few inches and back in and return it down. Once you're symmetric and you've done an even number on both sides, we're going to try extending the hip, okay? So this time we get the square of the pelvis, and then we're going to let one leg start to drift away and straighten, trying to make sure that there's no pull on this ASIS as I engage the back of the hamstring and lower glutes to extend that leg. So ideally, once that leg gets to 180 degrees and is flat on the mat, you haven't either pulled forward here or dropped or anything else. Once the leg is extended, we're going to engage the core musculature, and then with the psoas, we're going to lift the leg a few inches, hold it there, externally rotate in the socket, no dropping on this pelvis, return the leg to the kneecap pointing straight up, and set it back down. You can either stay on this leg repeating for about 5 to 10 reps, or if you'd like, you can alternate sides. Maintaining your core, extending your leg, lifting with the psoas, externally rotating, returning, and setting down. The psoas attaches to the lesser trochanter of your thigh bone, and then it attaches into the vertebrae on your lumbar spine. As you're lifting this leg, if you do not stabilize the core with the transverse abdominis and all your core musculature, the shortening of that psoas will pull on your lumbar spine. So it's really critical that this is all knit together every time we lift the leg and return it. Otherwise, what you may see is something like this. As the leg extends, the back arches. That's the psoas pulling my lumbar spine up because it's short and I haven't used my hip extenders to bring my leg down. And then now when I lift, it pulls on my back. That's incredibly dangerous. It pulls on individual vertebrae in the lumbar spine, and we do not want that. So make sure everything's knit together when you're doing this. If somebody saw just you from the waist up, they would have no idea your leg is moving because the weight of the legs is not pulling on your spine. Good. Oops, sorry. Hard to talk and move at the same time. Once you've finished those 3 exercises, we can actually add an additional challenge. We can do shoulder bridges, trying to maintain the stability of the pelvis, and we can do shoulder bridges on unstable surfaces. So some of these exercises may require props. If you don't have them, you don't have to use them. We can have a partially inflated ball, or you could also try it on like a soccer ball that belongs to your child. And then we also have a foam roller. So if you have those things available, you can use them. We'll do a version without any props first. I must say that I don't suggest progressing onto this version until you feel really successful with those first 3 exercises. The knee folds, the knee sways, and then this straight leg lift with external rotation. Okay, once you feel successful with those, you can try these. Again, finding the square of your pelvis, you're going to have your feet pretty much straight under your knees. And to do this shoulder bridge, I want you to start to push into your feet. Feel the hamstrings start to pick up the sits bone, so you are going to have your pubic bone starting to come up faster than your ASIS is. And then you're going to shift all of that weight that was in your heavy pelvis into your strong hamstrings and glutes as it starts to lift. You'll see that this lifting motion is hip extension. So down here my hip is flexed, and then up here my hip is extended. Once the hip is extended, you will look again for that symmetry from side to side. The pelvis is nice and square. And then you can start to lift one leg into the knee fold while the opposite leg is extended in the hip. This is a considerable amount of exercise and work for that standing leg's glute and hamstring. So when one leg comes up, you don't want to see the other side drop. That demonstrates a weakness in the back of that leg. So we want it to stay nice and stable. You'll probably find that this version of the exercise is more work for the back of the leg and the glutes than for your core, but they are critical in the proper functioning of the hip socket and pelvis. After you feel symmetric on both sides, you've done an even number on both sides, you can lay your spine back down. If you find that version with the knee folds during the shoulder bridge is too challenging, you can just come up into a shoulder bridge and then lay yourself back down. I want you to really seek the hamstring work in that exercise and a lot less work in your back. So you're not just shoving yourself up with your back or any kind of clenching in your sacrum and tailbone, but rather you're feeling your strong back of your leg picking you up, your strong belly, shortening your abdomen, and that's what helps extend your hip and lift you into the shoulder bridge. You can also leave your hands here and press a little bit through the back of the arm for some stability. If you find that to be easy for you, then you can do a version on a foam roller. This is a nice unstable surface, at least in one direction, and you'll find that you have to contract your hamstrings more than when your foot was flat on the mat to keep your feet from sliding away, okay? So you're gonna put the arches of your feet onto the foam roller, still hip width apart at the knee and the feet. If you'd like, you can keep your hands on your pelvis, and you're gonna start the motion by shifting the weight onto the feet, engaging the hamstrings, and feeling the hamstrings pull the sits bones up and up and up. Probably when you're on an unstable surface, you're going to want to keep your hands flat, but some of you may be able to keep your hands here. In this position, you can just come up and then lower down, or you can do a version where you do knee folds as well. If you're going to do knee folds, please make sure your arms are on the mat because this is incredibly unstable. So you can try lifting one leg in, lowering it down, engaging here, lifting the other leg without any dropping of the pelvis, and lowering down. Not forgetting to breathe. Very nice. And then probably the most challenging version is when we're on a ball, because now the ball can move in multiple ranges. Not just forward and back like the foam roller. And if it's slightly deflated, it'll be some nice work for your feet. Depending on the size of your ball, almost always you're probably going to need your feet together, which means your legs will be together, knees touching, so that everything is lined nicely out of the hip. And then same thing, you're going to shift the weight into the feet, and you're going to feel the hamstrings engage, the low belly lifting in and up, and you extend the hip and arrive in your shoulder bridge. It would probably be very challenging to do knee folds on a ball, but if you're super ambitious and strong, you can give it a try. Lots and lots of hamstring work as soon as you're on these unstable surfaces. You'll feel a lot of work there, possibly some cramping in your arches and calves as well. Inhaling up and exhaling down. If you don't have any of these props and you would like an additional challenge, a version of a shoulder bridge you can try with your feet flat on the floor is to extend your hips. Feel the front of the hip opening, okay? You want to make sure you're not rotating the pelvis to do this. And then once you arrive at the top, you can try the straight leg so as lift that we did previously. So the leg can come down to the mat and it can lift up. Again, looking for hikes and drops. Lots of work on this standing leg. And then bring the foot back in. The other leg can extend out and lift and lower. This is very similar to the shoulder bridge exercise that Joseph Pilates has in his mat repertoire. When both legs come back to the mat, watch if you actually have to level your pelvis at that point, or if you could have maintained the levelness the whole time you were balancing on one foot. Lower yourself back down, and then if you'd like, you can bring your knees into your chest and just roll a little bit through your back to massage it. Nicely done. I hope you enjoyed that little bit of core stabilization with hip mobility, strengthening the core musculature, and a lot of the abductors and external rotators of the hip.